I
And
can.
I'm going to put it on.
That one is mine. Dr. Colters, that one is mine.
There should be. I think this is.
That is mine. That was mine.
All right. This is updated one, and
Okay.
start the presentation. Okay. Can you see that?
I can
Yes,
see
we're
it.
seeing that.
Okay. All right. Well, thank you again, Mrs. Clark. And thank you, Mr. Vassal, for giving me this opportunity to speak to the Bottom Road Youth Program, which is a program within the Adventist Church. So, as Ms. Clark said, that anytime I get the opportunity to talk to young people, I'm there. So I appreciate the opportunity to talk and to talk about something that I'm very passionate about. Oral health is something that I have been practicing for over 20 years now, and I have gone all over the world from Africa to Central America to South America, Europe, and have done many things in global health. And one thing that a lot of people do not understand about the mouth, and I'm saying the mouth rather than the teeth is the last thing that we look at. You know, the teeth is the manifestations of disease functions that's going on within the mouth. I normally will tell a lot of patients, and actually I don't see a lot of patients now. Can you all hear me well?
Yes, we're hearing you.
Okay, great. Right. So I tell a lot of my patients that we can tell as dentists, we can tell many things that's going on in the body. For example, if a patient came to me and that patient does not know they have high blood pressure, for example, you can look in the mouth and there are manifestations of high blood pressure that is there that the dentist can say, you know what, you need to go to your physician, your medical doctor to check on your blood pressure because your blood pressure is out of control. Or we can see someone just by looking in the mouth whether or not they have controlled or uncontrolled diabetes. So all of these metabolic type diseases manifest itself in the mouth. So what I'm going to do, I'm going to present, just the basics, just to give you an overview of good, proper oral health. And I will start by um, discussing, what the mouth consists of. So as you can see on this PowerPoint, we have the mouth consisting of four types of teeth. So you have the incisor, which is your top left, the canine, you have the premolar, and then you have the molar. Now, each one of those have a specific function, which I will talk about, but these are basically the four sets of teeth that you have. Now, if you are, let's say, age 9 and below, can anyone tell me which one of these teeth you would not have? Of the four, which one would you not have? Anyone?
The molar.
No, you will have a molar. You will have a molar. Another guess? And I will show you why later on. So you will not have the premolar. So the premolar is the one that children do not have. Okay. And the teeth are made up of a very hard substance that's called the enamel, which is the outer shell of the teeth. And it's actually the hardest substance in the human body. So this is the mouth. Then, as you can see, you have the tongue and that pink area. That's your hard gingiva, as we call it, or your gums. And all of this makes up the oral cavity. So if we were to look at the incisor, so the incisors are located, it's found at the front. And, you know, when we talk about the pretty smile, this is what we really look at. This is what we're seeing is the incisor. The function of the incisor is to bite. And that's basically its function. It doesn't chew, it doesn't rip, it holds and it bites. The second one, the canine, these are found at either sides. They're found at the arch. Now, in the picture, you will probably see that the root is longer than, you know, any other teeth. And the reason for that is it's found at the sides. Basically, when we talk about your jaw corner, this is where it's found. And basically, it's the arch. It's the column that holds up the arch that gives the face its form. So it's a very, very strong tooth, and it's very, very functional in that it's supposed to puncture. So you hold your bite and you tear. So just like we call a dog, we see a dog when the dog is snarling and you see its teeth, the first thing you see is the fangs, and the fangs are considered canine. Then you have your premolar. So your premolars, it's a cross between the canine and the molar, and that is used for grinding food. So it can also pierce, because if you see that little pointed top, it can pierce, but it's basically used for grinding. So if you're eating corn and the ear of the corn, this is what you use. You would be using the premolar to grind. And then we have the molar, okay? Can anyone tell me how many molars we're supposed to have? And you can count it if you like. Can anyone knows how many? Okay, everyone's quiet. Okay, so we have, go ahead, I'm sorry.
12.
Yes, we're supposed to have 12, okay? So we have 6 at the top and 6 at the bottom. Now, some people will not have their third molar, which is the very, very last tooth in the back. And that third molar is also called the wisdom tooth. So that's the last tooth that comes in your mouth, okay? And that is used for grinding. So once we grind and chew, so it will make the food really, really fine, and that's the last tooth that the food encounters before you swallow. So first we have the incisors that bite, the canine pierces and tears, the premolar grinds the food, and the molar also grinds, but it definitely pulverizes the food, and that's how we swallow the food. So as I had mentioned, the enamel is the hardest substance in the human body. And because it's hard, it's very hard to get a cavity, but you will find that the cavity, a decay, is the most common disease of childhood, and we'll go over that. So right below the enamel, you have the dentin. So the dentin is yellow. It's a little bit softer than the enamel. And then right below that, you have the pulp. So in the pulp, you're going to have a lot of blood tissues. You're going to have nerves. You have veins. So when you get a toothache, this is where the pain is coming from. The pain is coming from the pulp. And if someone ever had an accident and they break their teeth and they see blood coming from it, this is where it's coming from. Do I have any questions? No? Okay. Okay, so now this is a very interesting x-ray. So this is an x-ray of a 5 or 6 year old. And can everyone see the red arrows?
I can.
Okay. All right. So remember when I said the premolars? So if you start at the right side where you see R, if you look at the second arrow, that's pointing to that little tooth in the bone, that's actually your premolar. So you only have the rest of your teeth, you will lose all of your teeth except the premolar because you only have one set. It's not a deciduous teeth or tooth. So this is the radiograph or an x-ray when you go to the dental office and we say, let's take an x-ray to see what is going on. This is what you will see. The first arrow will show you the molar, the first molar that's coming up. So when I see that first molar coming up, I automatically can tell you that this child is 6 years old. So the mouth can tell you a lot of things. The top arrow on your left-hand side is showing you the baby premolar that you will lose, and then right beneath that is another tooth that is coming up out of that position. So if you see how wide the roots are, where it fits directly into that little slot, when you lose your baby teeth, these ones that are so small look like they're in a little bubble. Those are the ones that now become your permanent teeth. Do I have any questions on this? Usually this will trigger a lot of questions.
I have a
Yes.
question, Dr. Colters.
Yes, ma'am.
Okay, so some of my children, as here, they will have the second arrow that you're pointing, right?
Mhm.
So that would be where the tooth started to decay. Is that what it is? Where the second arrow moving from the right is pointing?
Okay, so yeah. All right. So no, so what you're seeing, all of what I'm pointing to in the arrow, they're actually inside the bone. So if I was to look inside your mouth right now, you won't be able to see any of this. So the ones that look like they're not formed or they look like they're in a little shell or a bubble, think about it as though it's an egg and the chick is inside that egg. So you won't be able to see it, but once you lose the top teeth, all of those little ones in the bottom, in the little bubbles, which is in bone, will then come out and be present inside the mouth.
Okay, so if a child have 3 of them back to back behind one another,
Right.
what does that represent?
Okay, so if you look at the third arrow, so your third arrow from the right, so that's the one that's pointing to the front.
Yes.
So if you see the ones that's pointing at the front, what that's telling you is that they have retained the baby teeth, and the permanent teeth is trying to come up, but it's not it's not coming up right underneath it, it's coming up behind it. So what needs to happen as a treatment plan is that you need to extract the baby teeth, and then the permanent teeth will come into the arch, and the tongue, because if you think about it, once the new one is formed, it's going to come behind the baby teeth, right? So it's almost like you have two rows of teeth. So once you take away the one from the front, the baby teeth, the permanent teeth behind will come into its place. The tongue will then push it into the arch. So that's how the normal mechanism works. Sometimes it works that way, sometimes it doesn't. That's why you will see many children with braces. It's to help them get the teeth into the arch and to align the teeth properly. Okay, I think I heard someone else was trying to ask another question.
Yes, I was asking if my 6-year-old should lose a molar, will it grow back?
If your 6-year-old was to lose, well, it depends on which molar it is. And I think I may have another slide, but if your 6-year-old was to lose the molar, what comes into that place will be the premolar. So it's a premolar that takes the molar position of a 6-year-old. So that question is, so if you look at the top arrow on your left-hand side that's pointing down, that tooth that they're pointing at, not the one below it, but the one that's being pointed at, that is a baby molar. And right behind, underneath that, is your premolar. So that's the premolar that's going to grow into that position. Now, to the right of that, so that's just right beneath the arrow. That's a permanent molar. If you see how big that is, it's kind of big and it has a white top. That's a permanent molar. She doesn't want to lose that. So we have to protect that tooth from decay, because that tooth is going to be with her for the rest of her life.
Wow.
Okay.
And what is the cutoff age for not going back it? 2.
For not growing a molar?
No, not the molar, like a front one, like the incisor.
Okay, so they will start losing their incisors about 3, 4, actually about 4, 5-ish. So all the incisors, the permanent incisors, should be in the mouth by about 6 or 7 years old. So those teeth you want to definitely take care of. No decay, because once you lose it, there's not another one that you get. So by the age of 6 to 7 years old, they should have all of their front permanent teeth. Younger than that, and if they have not lost their teeth, they will lose it to that age, and then they'll get their permanent teeth. So what you're actually seeing here with the third arrow, that's one that's pointing straight up. The reason we can say this child is 506 is because you can see those permanent teeth being formed, and then right above them you see those smaller baby teeth that's there. So they can lose the one at the top. The one at the bottom, they should not lose, because there's nothing else to replace those. Okay. All right. Moving on. So how do we form a cavity? What happens to get a cavity? So, and I will just go by the picture. So you have a bacteria. So that little gremlin looking thing, consider that a bacteria. The bacteria, and I will use a scientific name, is strep mutans. That's the name of the bacteria that basically cause the majority of decay. But that bacteria then feeds on the food. So what type of food? We're talking about sugary foods. If you drink a lot of soda, a lot of Quenchade or Kool-Aid and anything sweet. So the bacteria metabolizes the food and it forms an acid. Okay. So once that forms an acid, then the acid then attacks the healthy tooth. So if you see the second row, you have a healthy tooth plus an acid equals decay. Now, how is the bacteria kept on the tooth? Well, if you right now, if let's say you had lunch, okay, and if you were to rub your tongue on your teeth right now, and it feels kind of rough, it doesn't feel very, very smooth. Well, the reason why it doesn't feel very smooth is what we call plaque. So plaque is a sticky yellow or sometimes white glue kind of that sticks to the teeth. So when it sticks to the teeth, the bacteria is in there. The food is also inside the plaque. The bacteria is eating the food and they're making an acid. And as we know, the acid is strong enough to then wear away at the enamel. So the last set, you will see what actually happens right here. Acid wears out the surface of the enamel. So on the top of the teeth, it wears it away. The longer we leave it, the bigger the hole gets. And the bigger the hole gets, now it has gone through the enamel. It has gone through the dentin. And as you can see in that last picture, it has now gone into the pulp. And we have our little pain scale right here. So no pain or not painful is very subjective. And the reason I say it's subjective is because you physically won't feel any pain. However, if I gave you a glass of ice water to drink and you have a sensitivity, that's telling me that you have something going on. So it's not painful at room temperature, but if I was to put something cold on your tooth, it will give you a sign of pain, which would be indicative of the green. Even though it says no pain, you can still have pain. Painful and very painful, those pain will come at any point. Individuals with high blood pressure, for example, tend to have pulsating pain. And when it pulsates, that's when it becomes very, very, very painful for individuals with high blood pressure.
Dr. Colthrist,
Yes, ma'am.
we have a question. Do you want the question to wait until the end, or you want us to
Oh
interrupt?
no, I can answer as we go along. That's fine.
Okay, so there's a question from Miss Green or Mr. Green. He said, what if I have a child and his or her teeth is buff? At what age he or she should wear she wear braces?
Okay, so that's a great question. You want to have braces or put on braces once they have their permanent teeth. So usually, we talk about teenagers, so 13, 14, 15, but you definitely want them to have their permanent teeth before we put in braces. But it's not only braces, because there are many other reasons as to why they may have a protrusion. So when we call it buck, we're talking about a protrusion. So if they have a very narrow face, for example, the teeth may be too wide for it to fill the arch. So that's where you will get a protrusion. So sometimes it may require extracting one of the premolars believe it or not. Extracting one of the premolars and pulling everything back to get everything in alignment. Sometimes it's the constriction of the arch, and I'm just going to go back right quick just to show you what I'm talking about. For example, the pink at the top inside the mouth, that's what you call the arch or the vault. And sometimes it may be narrow. So if it's narrow, we'll have to do what is called an expander to expand the arch, and then put the patient back in braces for that. Okay.
Okay.
All right. So we've discussed how cavities are caused. So what does a cavity look like when you go to the dentist and we say, let's take an X-ray? So by taking an X-ray, we're able to see what the eyes normally cannot see. So for example, the picture on your left-hand side with the yellow arrows, all of those yellow arrows are pointing to a decay. So you can, if you may, and I'm not sure if you have a good resolution, but you'll have to look very carefully if you can see some very dark spots on the teeth. I think the best example, if you look at the bottom, the first picture, but at the bottom, the two arrows that's pointing to the last two teeth. If you see those dark shadowy areas, that's what you consider proximal caries. So if I was to see this, if this came into my office, I would say that this patient does not floss. So there is no flossing, and that is where once the food gets trapped between the teeth and there is no flossing, meaning that you don't remove the food over a period of time. Remember, as I talked about the bacteria, the food, and the acid, this is exactly what's going on in that area. So that's where you will have a cavity. This may or may not be painful. If you go over to your right, where you see the blue arrows, you see that dark area right there. So that is a hole in the jaw, okay, within the bone. And how did we get there? Well, if you see the green arrow, which is similar to what we talked about in the first picture, that was left and it got bigger and bigger and bigger and bigger, and it went into the pulp. So now the pulp is dying, and then it drains down into the bone, and that is the infection that you now have. So this is very painful. This is very, very painful. And you will probably have a swollen jaw if the patient were to be presented with pain. Okay. The bottom. I'm sorry. Go ahead.
Okay, so the questions are coming in on from YouTube. So probably that's why you're not seeing them. The
Right.
question is, can he or she wear braces at 6 years old?
No. They can wear an oral appliance depending on what the dentist is trying to treat. But braces, no, because they don't have. So if we were to look at the bottom, let's look at the bottom slide, the bottom picture. Okay, this is what we call mixed dentition. It's mixed. That means you have permanent and you have primary teeth here. There's no way, and this patient is about 7 years old. It's about 7. Yeah, about 6 or 7 years old. There's no way to put braces on these teeth here because every other tooth they will lose at some point. So I can't imagine what a treatment plan would be to have children in braces. So the answer would be no, you wouldn't want to do that at all, unless there is some indication that they need some type of oral appliance. Okay, was there another question?
No, sir.
Okay.
But speak up a little bit louder. Your voice is
There is
breaking.
another question.
Okay, there was another question?
Yes, I want to say something.
Yes, ma'am.
Okay. So, Doc, my son is 6, and I've been hearing about CAP.
Okay.
What is it? What is it about? Because he has to get braces at some point. But I guess like somebody says like you have to cap it before he reach 8. And after he changed the teeth out, then the braces can apply. What is that?
What is a cap? Okay.
Yeah.
I think I have a picture, and I may be jumping here. So let me see. Do I have a picture? Okay. All right. So actually, so you led me right into this one. Okay. So the first thing, a cap basically means a crown. It's like a silver crown. Okay. So when you think about, let's say you open up a bottle of soda, okay, and you drink the soda and then you're going to put the cap back on there. Well, you put the cap back on there because you don't want, any ants or fly or anything to go inside the bottle, right? So you're going to cap it back, right? So you think about it in those terms. A cap is something that covers the teeth. Now, why would you want to do that? So if your child is 6 years old, I'm assuming that your child has the 6-year molar, okay? That has come in. So sometimes they may want to cap the tooth to prevent a cavity. So let's take the top picture to your right, for example. If you see that black hole on the molar, that's the last teeth.
Yeah.
The last tooth back, actually on both sides.
Yes.
So that's decay. You don't want your son or anyone to lose that tooth. So we'll go in there. We'll clean it out. We'll make sure that the decay is gone, the bacteria is gone. And then what you will do, you'll cap it because you want to maintain the tooth in the mouth. That's one. And two, you want to maintain the space, because if you lose the tooth, you're going to lose space. And then if you look at the bottom pictures, you have those big teeth underneath there that needs to come out. And if they don't have any space to come out because you lost the top teeth, then we're going to have problems. And then you'll have to have braces and all kinds of things. Okay, so we want to preserve having the teeth in the mouth. All right.
Okay.
Go ahead.
So what you're saying then is that it can be kept at this age?
Yes.
And okay.
Yeah.
So it can cap and then braces apply after the changes of all the baby tooth.
Yes.
Teeth.
Absolutely. Yes. And that is actually a pretty good treatment plan, because they want to preserve, as I mentioned, they want to preserve the space because you don't want to lose the tooth.
Yes.
So that's why they will cap the teeth. They'll clean it out, as I said, and cap it. Yes.
Okay.
They will eventually lose it, but that's okay because the permanent tooth be underneath, as you can see on the last picture. All of those that look like they're in a little bubble is actually in the bone. They're ready to come out. So basically, they're ready to be hatched. you know.
Okay.
Yeah.
Okay.
So
So
I
I'll
will.
get the number from Elder Vassal and I will keep in touch with you.
Okay. And actually, what you can see here, if you look on the left-hand side at the bottom left-hand side, okay,
Mm, yes.
if you see the two bright white areas, the teeth, can you see those?
Yes.
Okay, that's the cap. That's what they're talking about.
Okay. Okay.
That's the cap.
Okay.
All right. And the reason why we don't want to lose those, because look right below them. You see those two premolars?
Yes. Yes.
So if we had lost those two at the top, okay, the last tooth in the mouth, which will be the permanent molar, which is the one to your far right, would lean itself. It leans itself into that space. Once it leans itself into that space, those two at the bottom have no way of coming out.
Oh.
You see? So
Oh.
that's why they want to maintain the space.
Oh. So that's why you cap it at an early
That's why you
stage
cap
too.
it. Yes, absolutely. That's why you
Oh.
cap it.
He's
Yes.
a suck finger child.
Yes.
Suck
So
finger on that. That's why he has to get braces.
yeah. Yeah. So
Okay,
that's why.
thank you. Thank you. I'll get the number from Elder Vassal and I'll keep in touch with you.
Okay. All right.
May I interject?
Yes, ma'am. Go ahead, please.
One
I
of the
see Henry Harding has his
please,
hands up.
sorry,
Brother
go ahead.
Harding.
Um,
Brother Harding.
Sorry for that, Elder. Sorry. Go
Okay,
ahead.
all right. You can go ahead, doctor.
Okay. I think Mr. Clark, you had a question.
Oh no, I was just interjecting before Elder asked. I'm sorry. The YouTuber asking if you have any offices in Jamaica. So can you kind of make it clear for the viewers on YouTube or the persons who are listening?
Okay. I do not have an office in Jamaica. I do at times lecture to the Jamaica Dental Association. Have been doing so for several years, but I'm with the United States military, and my full-time job is basically policy development and global health with the U.S. Army. So I don't have a practice in Jamaica. No.
Okay. Thank you.
Okay. All right. I would also like to draw your attention to the first picture. So when we look at this young man right here, you can see that he has several decay that's present. So what will happen there? It's without an X-ray, we can either clean out all those decay and put a cap on those also, because we don't want this young man to lose his front teeth, and that will also help him to create the space. So this young man here, he's about 5 years old. He's probably 5 years old. Now, I want you to take a real good look at that little bump that you see at the top. It's a little circle. Can everyone see that? That little circle just at the top of his gums.
Yes.
Yes. Okay. So what that is, basically his tooth is dead. And the reason I can say that is once the tooth is dead, it drains and then it eats through the bone and it comes out of the gums. Okay, so he has a fistula, what we call a fistula. So it's draining out there. And for him, that was very, very painful for him. So you think about all the pressure that was built up, and the pressure has to be relieved somehow, and it came out right at the top of that tooth. Okay, so that's another indication that to me that the tooth had died. Okay. All right. So, right, and that is what I wanted you to look at.
Dr. Colters, before you move on, there was someone that has their hand raised, but I had to
Okay.
interject, but I'm sorry about that. Maybe the person could go ahead and answer the question if you don't mind.
Okay. Hearing nothing.
I didn't have my hand up, but I have a question.
Okay. Yes, please.
The situation is the dentist checked the tooth. It was very strong, but it had a decay, and he said that the person had lost the tooth, but he placed some medicated fillings and said that after a time he would have put some permanent filling. But he was saying that is the wisdom tooth, and the person had already lost the tooth, even though it was very strong when he was testing it. So I don't know.
Yes. So if he had lost the tooth in terms of if the tooth had died, okay. If it's
Because the decay wasn't strong. The decay was it wasn't a deep decay. It was
okay.
no
All right, and they put some medication in there.
some medicated filling, and said that in later times he would have put some permanent filling above the medicated filling.
Yes, so that's actually a common practice also. What the dentist is probably trying to do is to rebuild the dentin. All right, so if you remember, I showed you the picture of the dentin. So they would have to go into the dentin, put some medicated filling in there, which is not acidic, but it's going to be basic. So this is where we go back to our science, acid and base. And that stimulates the growth of dentin and then makes it very, very hard. Then later on, they can either go back and take out the medicated filling or just leave the medicated filling. But one of the reasons why it's a two-step is to make sure that the nerve, the pulp, the one just below the dentin, is calm. So you don't want to go in there and then just put in a permanent filling and you have what we would call a hyperactive pulp, because there's not much space there. So the patient will have a lot of pain. So you put a medication in there to calm everything down. Once everything is calmed and there is a stable state within the tooth, then you can go and put in the permanent filling in there. So I'm just assuming that is that's the process without really knowing or seeing the case.
Yeah, thank you. I understand perfectly. But the thing is that baffles me is that he said that I already lost the tooth and it's just a matter of time before I fully lose it.
Okay, yeah. Without really seeing it, yeah, I'm not sure what would be meant by you already lost it, because if you lost, well, let me take that back. If you lost a tooth, then they can do a root canal and they still will put some type of medications in the canal to kill the bacteria. So it really depends on I would have to see and assess the tooth to come up with a prognosis.
Oh, okay, thank you.
Okay.
Dr. Colters, one question from our YouTube viewers.
Mm-hmm.
Mr. Ainsley Elsme, he said, I have a perfect teeth. Now my premolars have grown and dislocated my lower incisor.
Mm-hmm.
How can this be fixed?
And has dislocated
My lower incisor, INSCIS, the insider.
Mm-hmm. Mm-hmm. It sounds like it's a bite issue. So if it's a bite issue, he will probably have to have what is called a bite plane, which is not a denture, but it's a device that allows them to correct the bite. So it would probably require some type of braces to straighten the teeth and a bite plane to help him correct his bite. That's what it sounds like without seeing it.
Okay, thank you.
Okay. Okay, moving on. So how can I look after my teeth? So the first, the basic thing is brushing. That is the best, that's the quickest, and that's the easiest way to take care of your teeth. Now, many people brush their teeth the wrong way. They brush it that goes back and forth, okay, or up and down, like they're scrubbing. But in actuality, the best way to brush your teeth is in circles, very small circles that go round and round and round, all the way, front and back, and at the occlusal, which is the flat area. So it's important that we do that. Many people like to use the hard bristles because they think that they get a better feel and it's cleaner when they do that. My position on that is the harder the bristle, the worse it is for your teeth, because you're not only scrubbing away and creating defects in the enamel. And remember, once we lose an enamel, if it's chips, it doesn't grow back. And then the gums, if you were to scrub at the gums, you will start losing the gums. Once you lose the gum, then the root of the tooth will be revealed. And then the root itself is made up of what is called cementum, which is very, very soft. So now you're more prone to having cavities and decay and all of that. So you do not want to use hard bristles. You want to use medium. And for babies, let's say from 0 to 3, you can use soft. Okay. So for babies, you can use soft. Actually, even up to 6 years old, you can use soft. And then anything with your permanent teeth, you can probably use the medium bristles and do it in circles. Okay. Just a circular motion. Also, try not to eat too many sweets and candies and anything that's sticky, because it tends to stick to your teeth. And as I showed the decay process, the plaque sticks to your teeth, and then obviously the sticky food will stick to your teeth, and that's not good. And obviously visit the dentist at least twice a year for cleaning.
Dr. Colters?
Yes, ma'am.
Latoya have her hands raised. Latoya
Okay,
Hunter. Go ahead, Latoya.
Good evening, Doc.
Good evening, ma'am.
It's not really about the teeth. It's about like your jawline and your gum. When you have this sock like cloth on your jaw.
Okay.
I am wondering, because sometimes it comes up and then it goes away. I'm wondering if when you're ingested, if it is of any harm to you, or if it's a medical condition that you have to pay attention to.
Okay, so talk to me a little bit. You say it's a sac on your jawline?
Yes, or behind one of the teeth that with like blood in it, like cloth.
Okay.
Sometimes it's on the jaw, inside of the jaw. Sometimes it's behind the teeth itself.
Okay. And is it white or yellowish?
No, it's red.
And
It's
it comes
red
in.
like,
Okay, so you said it's behind the teeth. Okay, got you. So it's behind the teeth, right? And
yeah,
it,
like the last teeth, like the
yes,
molar,
yes,
right?
yes, yes. And it's
Or
very pain.
sometimes it appears on the jaw line.
Yeah, and it's painful, correct?
No, it's not
It's
painful.
not pain.
'Cause-
Okay. So what it sounds to me, and it could be either way. It's what you call what we call an operculum, which is it's normally found behind the last tooth. What it is just an overgrowth of the tissue. The reason why I asked about pain is that sometimes, and usually it's at the bottom, right? It's behind the lower teeth and not the upper teeth, correct?
Right, right.
Right. So it's found at the lower teeth. It's what we call an operculum. The reason I ask about the pain is that sometimes the top teeth will bite down on it and it can cause pain. So this is just a natural, actually, I shouldn't say natural. It 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 can it occurs. Sometimes it's swollen, and then sometimes it goes away. So sometimes when it's engorged with blood or it's swollen, it's because there's an
Right.
infection. It's an infection that's going on. Once the infection goes away, it tends to subside and go away. Once the infection is there, it tends to enlarge. So what needs to happen is that you need to um, floss back there. That's one. Two, you can use warm salt water and vigorously rinse back there on both sides and swoosh and expectorate, basically spit out the water from. Okay.
Okay.
But you definitely have to clean back there because I think what is happening is that you have a space between the last tooth and there's a space between the last tooth and the gums back there. So food is getting
Right, right.
packed down in that area. So you definitely have to clean that out. Sometimes here's another way to really do that. If you have a syringe, if you could just buy a syringe at the pharmacy and you just fill that with salt water and then go way back there and just squirt it into the area behind there and flush it out. So that's what you're trying to do. You're trying to flush out the food, the debris, the bacteria from the last tooth.
Okay.
Okay.
Yeah. So it's called an operculum. So it occurs. And it does become painful if you start biting down on it, and it will start bleeding, and then it will get worse from at that point.
And it doesn't cause any
Now, it the only
tension or
discomfort,
anything to the
yeah,
jaw or the
no, the only issue that it's going to cause, it's pain. That's going to be there. If you start biting down on it,
Okay.
obviously infection, and it probably needs to also be cleaned out at that spot.
Okay. All right, thanks.
Okay.
I have two more questions on brushing. So one of our viewer on YouTube said, can you use baking soda with toothpaste to brush your teeth? And we also have another question in the chat from JS. And she said, how do you keep your breath fresh all day? I mean, other than brushing and flossing.
Okay. Great question. Baking soda, a lot of people use baking soda. Baking soda is very abrasive to the teeth. What well, 99.99% of the dentists would recommend that you brush with some type of dentifrice, which is a toothpaste, with fluoride. Fluoride, and I haven't really mentioned it, and I was going to mention it in my next slides, but fluoride is really what you want. Everything else, okay, is basically a soapy scrubbing material. The most effective thing that you can do is brush and fluoride, right? So baking soda, I would just say that it is very abrasive, and you actually over a period of time, over many years, will cause more harm than good. So definitely, I would recommend some type of toothpaste. I don't, recommend this one over this one, as long as it has fluoride would be the my recommendation. Your breath. So here's one of the things. So what causes bad breath is basically sulfur producing bacteria in the mouth. So you definitely want to keep your mouth moist. You can sip water. Some people will sip, orange juice or other beverages. That actually is not necessarily the best way to do it. You want to do water, something that without sugar, and obviously you can have breath mints, and ensure that you have a regular visit, ensure that you have a cleaning, because here's another thing: without the cleaning that goes below the gums, so it's not only the teeth, but it's what's below the gums. If you have periodontal disease, basically gum disease, if you have gum disease, necrosis, basically your gums are dying in the mouth, and then it's like, it gives off some types of odor. So you want to have a regular cleaning to make sure that all the dead tissues and the bacteria, the food, everything is being removed. That's why we recommend a visit twice a year, and then definitely keep your mouth moist. Sometimes we have ice mint. I remember we used to like ice mint, but that only works for about an hour or two. But what is ice mint? Ice mint also now has the sugar. So we're actually backtracking. So the best way, keep your mouth moist, sips of water, and brushing and cleaning, and that will definitely help the process. Okay, do we have another question?
Tristan he said, he's on YouTube. He said, can the doctor speak patois since he's Jamaican? Not sure why. He has a question, so that's give us a smile.
I have to speak many languages.
Okay. There you go, Tristan.
Yeah. Okay. All right. So we'll go to. All right. So foods. What foods are good for your teeth? Okay. Can anyone tell me which of all of these foods is not good for our teeth? Which one of the pictures?
Anything with sugar.
So of any of this, which one is not good for your teeth?
I'm thinking the one
with the donuts, candy thing.
burger.
Yeah, and those I'm telling you, that's some good food there, right? But nope. Yes, we can't.
Sugar and acid.
Yes, and believe it or not, I would tell you, and this is for mothers, any mothers out there with young kids. Now, I have milk up there, so we look at milk as being good for babies, and they are. It is. It's very, very good. But when you give the baby the milk bottle and you put them down to sleep and they still have the milk bottle in their mouth, it causes cavities because milk has a sugar that is called lactose. And it pools in the baby's mouth, especially when they have teeth, pools in the baby's mouth, and it gives them cavities. So what I showed you earlier, and I will go back up, these, what you see here, that could easily be caused by milk. Let me see if I have any more. I don't. But so we have to be very careful how we nurse babies, especially when they have their first teeth at the bottom. At that age, once you give the baby the milk, you can use a towel or their binky or anything, a cloth, and just wipe the teeth. So milk is good, but don't give a baby any milk and put them to sleep. You need to wipe it off of their mouth, off the teeth. But everything else here is good. This is a healthy diet.
I see Latoya Hunter. I'm not sure if she has another question.
Okay.
Latoya? Probably her hand never went back down.
Okay. All right. And this is basically the same thing, foods that cause tooth decay. As you can see, I mentioned the sugary drinks and the sugary foods, definitely a no-no. So it's not saying that you cannot eat it. That's not what, the dentist would recommend. But a lot of people live off of sugary foods. So yes, you can eat it. Everything is in moderation, but I would even say just a little less than moderation, and you should be fine. But ensure that you brush. So, and this is what we basically said. Brush regularly, visit the dentist, definitely floss, a sensible diet, as we had just seen. And a lot of people, again, do not look in their mouth when they're brushing their teeth. It's very important to look in your mouth when you brush your teeth. I started off saying that the dentist can tell a lot of what's going on. So inside of your mouth, if you see anything that is very, very red, black, blue, or white, okay, it's time to definitely see your dentist. We have what is called pathology. We have blue diseases, black diseases, and white diseases. And if you see any of those color inside of your mouth, whether it's under your tongue or whether it's on the gums or on the cheek, it's time to visit your dentist. So it's very important to look in the mirror when you brush. You would not believe that so many people, they just pick up the toothbrush, put a lot of toothpaste on it, and then you're not really supposed to put a lot of toothpaste on it. And they just brush and spit it out. And which leads me to this other point. Many times when we brush and then we rinse out our mouth, okay? That is actually the wrong process. When you brush and you have a mouth full of toothpaste, you spit it out into the sink, and that is it. You do not rinse out your mouth. You leave it alone. You do not eat for at least 30 minutes. So if you're going to eat, the best thing to do really is to wake up in the morning. If you want to rinse your mouth out, eat your breakfast, then brush your teeth. And when you spit out the toothpaste, do not rinse your mouth out at that point. You leave it on there. Can anyone tell me why I recommend that?
I'm not sure if the fluoride has something to do with the teeth to help to strengthen the teeth or something to that effect.
Yes, absolutely. It's because of the fluoride. You want to have the fluoride in contact with the enamel at all times for the longest possible. So once you brush and you rinse out your mouth, well, what you have just done is you've just rinsed off your toothpaste. So it makes sense you brush with nothing, because what you just did, you just rinsed off everything. So yes, you're absolutely correct. We want to have the fluoride in contact with the tooth surfaces as long as possible. So at least 30 minutes. And then that would be, that's the best way forward. For some reason, we somehow have gotten it wrong all of our years. We've been told to brush and rinse, but it's actually brush and spit out and don't rinse. So that's the way. That's the way forward. Okay. And that brings me to the end. Thank you for listening, and I would now open it up for questions.
Yes, I have one. So Miss Green is asking, these are YouTube questions. What kind if a baby cannot drink milk or no form of milk, what kind of substitute can they drink? That's one question. We have a couple more to go.
A substitute. So a substitute for milk, that will basically come from their pediatric provider. Usually, if a baby is intolerant to milk, they have to do some type of workup to find out, why and what is a substitute for that. So that's a difficult question to answer without some type of additional information. But usually, so in Jamaica, water is supposed to be fluoridated. So at least I'm confident that they have fluoridation, some type of fluoridation. Back in the days, Jamaica used to have fluoridation or fluoride in the flour. And if you buy milk at the grocery store, it would have some type of fluoride in there. But for that specific question, that will have to come from the pediatrician to answer that question.
Okay, second question. Thank you, Dr. Colthrist. Second question is, which is the best toothbrush to use, soft or for gentle teeth? Soft or for gentle teeth? I guess this person came on late.
Yeah, so it's going to be soft. I would go more with a soft to medium bristle type, more so than hard. I would never recommend hard. So soft to medium.
Okay, thank you. The other one is from Georgia Brown. She said, can a yellowish coloration of the teeth be corrected? And what is it depicting if it's yellow and not completely white? Okay.
All right. That's actually an excellent question. So the color of your teeth is dependent on the lucency, and I'm going back here. Okay. The color of your teeth is dependent on the lucency of the enamel. So what you're actually seeing, you're seeing the coloring of the dentin. So if you think about it, think about the enamel as a glass that you can see right through. If you're able to see through the glass, that means you're able to see what's beneath the glass. So the higher the color, or the more yellow the color of the dentin, the yellower your teeth will be. Additionally, the color of your eyes, the whites of your eyes, from a chromatic standpoint, it matches your teeth. So can you have whiter teeth? Yes, you can have bleaching for whiter teeth. Um, but it depends on how much shade. So you can have different shades of white, but if it's very, very, very yellow, it's going to be very, very difficult to have very, very white teeth. Also, having white teeth or bleaching your teeth, there's a downside to bleaching your teeth because it can make your teeth now become very sensitive to cold. And it also will be very sensitive to colored food. So if you're eating curry, for example, um, you don't want to have bleached, very, very white teeth and eat curry a lot, or drink coffee, or green tea or black tea and anything like that, because it's going to change the color of your teeth again. And those are what we call extrinsic stains. Um, so so the short answer is yes, you can whiten your teeth. You can also have what is called veneers that goes right over your teeth, which is almost like, it's similar to ladies putting on fingernails. It's a veneer that goes over your teeth. That's a possibility for color and for shape, and aesthetic things like that. So
Another question. Thank you, Dr. Colters. What brand toothpaste and toothbrush do you recommend and why? What about the children? I'm not hearing the children. And
yeah,
why?
so that's an interesting question. I mean, so I grew up on Colgate, and I'm very biased to Colgate. But does it say that Crest is not good? I think they're all good. Toothpaste and toothbrush. As I said, the standard should be the content of the fluoride. It should have, whichever one you use should have fluoride. Stainless is called stainless fluoride in there, and brushing in circles, and you'll be good at using any of those type toothpaste and toothbrushes. Just make sure you have the fluoride content in there.
Okay, thank you. So Stacy on YouTube said, "Wow, I didn't know all these things all these years." So that's Stacy comment on YouTube for you, Dr. Colters.
Okay, great. Now the mouth is very it's a very interesting system, and I call it a system because there's just so much going on. As I mentioned, the teeth is the last thing we look at as a dentist. We have to look at all of the structures. For example, if you have a misplaced bite, or if you have a wrong bite, let's say, that can give you back pain, believe it or not. The way how the jaws manipulate each other, how they come in contact, can give you headaches, neck pain. As I mentioned, we can also at least have some idea of some metabolic issues that's going on. For example, HIV, if someone has AIDS, we are able to detect it in the mouth way before the patient knows that, they may be HIV positive, or if they have AIDS.
Wow.
So it's possible. Yeah, there are many, many things that we can tell with the mouth. Then we look at the teeth. So for example, I will show you. All right, so let's look at this picture again. All right, and let's say this was an adult picture. Well, if someone had diabetes, and let's say they had diabetes 10 years ago, and I took this picture right here, and that 10 years ago I took that picture, and then I took another picture similar to this picture, all I will have to do is compare the bone height of the picture 10 years ago with the current picture, and basically can say that, I think you have diabetes. Why? Because there will be a decrease in the bone height. And sometimes the patient may or may not know that they have diabetes. So we can tell a lot of things. Also for young ladies, there's an association with low birth weight and periodontal disease. So if you're giving birth and you have periodontal disease, your baby may come out smaller and not as heavy, and you may have even a premature baby, and that's all indicative of what's going on in the mouth. So there have been studies and associations with that.
Thank you. Another question from Francis, Dr. Colthrist.
Mhm.
What amount of fluoride should be in the toothpaste? So sorry. So what amount of fluoride should be in the toothpaste?
So it should be 0.05 stainless fluoride that should be in there. So it should be on when you look at the toothpaste, it should be written right there in the ingredients. So it should be about 0.05 by weight or by concentration.
Thank you.
Mm-hmm.
All right. We are indeed grateful for this evening's program. Certainly, we have learned a lot. And there's a lot of things that I did not know that you could, by looking in the mouth, tell what is happening with the body. And Dr. Colthrist, I want to use this opportunity to say thanks on behalf of the members, the pastors, and the elders, leaders of the Bottom Road Seventh-day Adventist Church. We really thank you for taking the time out of your busy schedule to sharing our program this afternoon. We were really blessed. We're happy that you did, and we wish you all the very best in your endeavors and your new appointment. Mrs. Clark,
Yes, Mr. Vassal.
you are the engine behind this evening's interaction program, and we really want to thank you for sharing in our program this afternoon. It was a pleasure to have you, and we want to thank you and wish you too well in your pursuit as a manager. God bless you both, and may you have a wonderful and a productive rest of the evening and also the rest of the weekend. God bless you. Sister Trudy. Thanks.
Thank you.
Okay, Mr. Vassal, you are welcome.
And thank you
One
so
more
much
thing,
for this opportunity.
one more thing, Mr. Vassal, and Dr. Colthrist before you leave. Their attention, please. Mr. Vassal, if any of your members and friends that are on here this evening do have any additional questions or wanted to get more clarification on anything that is wasn't clear to them, They could probably forward the questions to you. We could find an outlet or Dr. Colters can answer those questions, whether through you or with a direct another method. Let us know because I'm sure that there's some more questions, but the time is short spent. So we're giving you an option they can forward to me, or we can combine a collaborate efforts as how we can get those questions in the hands of Dr. Coulter so he can answer questions.
Sure, we appreciate it, Jessica. Thank you again. And we really look forward to further interaction and engagement. Thanks very much, and have a good one.
All right. Thank you so much.
Have a good evening, everyone, and thank you.
All righty.
All right.
Amazing facts indeed. What an interesting presentation.
Amazing facts indeed.
What did you learn?
I learned that if you don't brush your teeth properly, you can get a plaque, which is very nasty.
I also learned that sugar, which mixes with the plaque in your teeth, will cause tooth decay.
Ew.
Thank you for that interesting presentation,
Dr. Colthrist.
Now we will turn over to our Vespers thought.
And it will be done by your sister McDonald. Dermot.
Good evening, everyone. Okay, our Vesper thought this evening will be keeping in line with the theme from this morning.
I am a child, but I will go. First Samuel 2, verse 18. But Samuel ministered before the Lord, being a child, girded with linen ephod. Samuel's life shows us that we can never be too young to serve God. Children, God has given us talents and abilities that can be used to do His work. Allow God to use us and the talents to continue His work.
You are children, but you can go. Parents, we must be godly examples in words and actions. In Deuteronomy 6, verses 6 to 7, and these words which I command thee this day shall be in thy heart, and thou shalt teach them diligently unto thy children, and shalt talk of them when thou sittest in thine house, and when thou walkest by the way, and when thou liest down, and when thou risest up. I pray that God will help us as parents to train up our children in the way they should go, so that when they are older, they will not depart from it. I know that parenting is challenging, but God can and will help us overcome any challenge we face, because with God, all things are possible. Let us pray. Father God in heaven, I want to give these thanks for this Sabbath, blessed Sabbath day, and the fact that it is Children's Day. We want to thank you for our children. We want to thank you for their talents and abilities, and ask that you may help us to help them to showcase their abilities so that they can work for you. We ask that you may continue to guide and protect us and to watch over us and our children, and help us as parents, dear Lord, that we may grow them up in the right and proper way. Forgive us of where we have failed thee, and anything that we fail of asking thee this day, Father, we ask that you fail not to grant it unto us. Bless, guide, and protect us throughout the remaining portion of this day and the following and the coming week. In Jesus' name I pray. Amen. Everyone, I hope that you have a good week and a productive week. Thank you.
Thank you, Sister McDermott and little McDermott, Macaria McDermott. Also, thanks to our presenter. We have really learned this afternoon. Thanks to Mikkel and Kyle for being our host this afternoon. Thank you, brothers and sisters. I hope that you have a wonderful week and may God continue to bless you richly.
Lord, I come, I confess, bowing here, I find my rest. Without you, I fall apart. You're the one that guides my heart. Lord, I need you. Oh, I need you. Every hour I need you. My one defense, my righteousness. Oh God, how I need you. Where sin runs deep, your grace is more. Where grace is found is where you are. And where you are, Lord, I am free. Holiness is Christ in me. Yeah, Lord, I need you. Oh, I need you. Every hour I need you. My one defense, my righteousness. Oh God, how I need you. Teach my song to rise to you. When temptation comes my way, and when I cannot stand, I'll fall on you. Jesus, you're my hope.